Life, it is all around us, from the pigs in the mud to the weeds in the cracks to the person sitting next to you. It can be seen in many forms. It is the most precious gift someone can give, a gift with no price tag. At this point, you are probably thinking that this video is about pregnancy and birth. Wrong. Women are not the only ones who can give life. With the field of medicine at its peak, men can join in on the fun too, without going through labor. How, you ask? By donating blood. My knowledge for the need of blood started at a young age.
Well, what was supposed to be a very exciting birth, first child, boy, we already knew that ahead of time. When I delivered, the placenta was left inside me. I kept feeling like I was having these labor pains after I had already given birth.
I was waiting in the waiting room for my baby cousin to be born. And instead of the nurses coming out with the baby or inviting us to come into the room, she ended up having to go into surgery.
And I don't know all the technical terms and everything, but next thing I knew, I had these needles in me, people are rushing, the baby's going over here, and I had to have this blood transfusion.
The nurses came out and told me that they gave her transfusion and that she was going to be okay and the baby was going to be okay, and I was very happy.
You know, I kind of look at it today and just say that, for, wanting to give birth and give life, it almost took my life. So I was just really happy that whoever donated that blood that matched mine, it was there for me to use. Otherwise, I wouldn't be here today.
So why should you donate?
It's really important for people to donate because patients need the blood every day. That's every day of the year. It's 24/7 in a 24-hour period. Blood donation can help save up to 3 lives, which is amazing. But unfortunately, only 5% of eligible donors in the United States actually donates blood. So it's an uphill battle. We're always looking for people to come in to donate blood.
And who exactly receives the blood?
It could be anybody. We all have a 1 in 3 chance of being a recipient of blood, and sometime in our lifetimes, people must have that blood at the hospitals in order to survive. And some patients, they only need the platelets, like a burn victim would need the platelets, the clotting factor, And for that, we do recruit donors that come in and give platelets. There are some donors that need plasma, and we have donors that give plasma.
Other reasons for blood transfusions include cancer treatment, surgery, organ transplants, blood disorders, and hemophilia. Are there any benefits for those who donate?
Well, yeah. They number one, they do get the huge benefit of knowing that they've made a difference to 3 people's lives. I don't know if there's anything greater than that. The blood you give could save your own life. I mean, there's a possibility of that too.
Volunteers also benefit from the many physicals given to them before the blood donation. These physicals confirm that your blood is in good health or inform you of areas of possible concern. This includes variables that can fluctuate daily, such as your body temperature, pulse, and iron and blood pressure levels. There are many myths and excuses regarding why people do not donate their blood.
There's just a lot of people that do, so I just don't find a reason to donate. I mean, if other people are donating, why should I?
If everyone were to think like Daphne, there would be no blood to use. In America, someone needs blood every 2 seconds. This means 38,000 donations are needed a day in order to maintain equilibrium between the amount of blood donated and that of which is being used.
Because I think that I'm too old and my blood's probably not good.
Although most donation centers require the volunteer to be at least 16 years old, there is no maximum age limit when it comes to donating blood. As long as you meet health requirements, you are golden.
So I had shoulder surgery a few years ago, and ever since then, I've wanted to donate blood, but I don't think that I'm eligible because maybe something with the surgery affected my blood.
Yes, some medical factors bar people from giving blood, such as being pregnant, having hepatitis, or being infected with HIV or AIDS. but not all medical conditions affect volunteers' eligibility. For example, diabetics tend to rule themselves out as possible donors, yet they are just as capable to donate as the next. Instead of deeming yourself ineligible, let the nurses at the blood center determine that.
Honestly, I really just don't want to get AIDS.
It is not possible to contract a disease through donation as long as a new sterile needle is used on you, which is required of the nurses.
I don't trust these needles. No, seriously, I did this once when a nurse was trying to take my blood and she couldn't find my veins, okay? She's, maybe because I was big boned or something like that, she couldn't find my veins, so I'm not going to do it anymore.
The actual donation takes no more than 10 minutes. The nurses are well trained and they will take all necessary precautions to make you feel comfortable.
Well, I'm just too busy. I have school, I work here, and then when I have extra time I like to just sleep or, occasionally hang out with my friends. I don't like to just go and give my blood away.
I do not care if you're Ryan Seacrest, Oprah Winfrey, or Angelina Jolie. No one is too busy to take an hour out of his or her day and donate. You can only donate once every 56 days. That gives you 1,344 hours to choose from when scheduling an appointment. Set up an appointment with 1-800-GIVE-LIFE today.